Are HPV vaccines effective against all cancer-causing strains? Let's dive into the question of whether HPV vaccines are effective against all cancer-causing strains. Human papillomavirus vaccines are specifically designed to protect against the most common high-risk strains of HPV. These strains are responsible for a significant number of HPV-related cancers, especially cervical cancer and other reproductive cancers. Over the years, these vaccines have evolved. Initially, there were bivalent vaccines that targeted HPV types 16 and 18, which account for about 70% of cervical cancers. Then came the quadrivalent vaccines, which also included protection against HPV type 6 and 11, known for causing genital warts. Now, we have nonavalent vaccines that cover 9 HPV types, including the most common cancer-causing strains. The nonavalent vaccine provides broader protection against additional high-risk HPV types beyond just 16 and 18. This increases the potential to prevent a larger proportion of HPV-related cancers, including cervical, vulvar, vaginal, anal, penile, and some oropharyngeal cancers. However, it is essential to note that these vaccines do not cover all possible cancer-causing HPV strains. There are many HPV types, and some less common strains are not included in the vaccine formulations. Research has shown that HPV vaccination significantly reduces the incidence of cervical cancer and precancerous lesions. In fact, vaccination programs targeting girls aged 12 to 13 have led to nearly a 90% reduction in cervical cancer rates among women in their 20s in certain populations. This highlights the effectiveness of the vaccine in preventing the majority of HPV-related cervical cancers. While HPV vaccines are a crucial preventive tool, they do not prevent cancers caused by other factors or viruses. They substantially lower the risk of HPV-driven malignancies, but do not treat existing infections or cancers. Therefore, vaccination should be paired with regular screening programs, such as Pap smears and HPV testing, to detect and manage precancerous changes early. In summary, HPV vaccines are highly effective against the most common high-risk strains responsible for the majority of cervical and other reproductive cancers. The current nonavalent vaccine covers 9 HPV types, expanding protection but not covering all oncogenic HPV strains. Vaccination has led to significant reductions in cervical cancer rates where coverage is high. However, it is crucial to continue regular screening and monitoring alongside vaccination for comprehensive cancer prevention. Always consult healthcare professionals for personalized advice and guidance regarding vaccination and screening.